And thank you for kind introduction. And first of all, thank you very much for the research grant. And it's the great honor to having my presentation here. My research topic is optimal graft anatomy and surgical strategy on living donor liver transplantation using right liver. The subtitle is risk of donor and recipient. The operative process of this patient selection and the surgical planning, the fully considering the graft anatomy and its reconstruction technique is crucial for the donor and recipient safety, especially in the right liver, living donor liver transplant. And the various reconstruction technique they have been doing in the various transplant center, however, there have been the limited number of studies showing its short-term and long-term outcomes in terms of the graft characteristic and surgical procedure and reconstruction technique. So in our study, we performed the various subgroup survival analysis considering the graft anatomic factor and the surgical procedure and reconstruction, the technique for the vascular and the biliary anastomosis. And this is a retrospective study between 2013 and 2023. And totally the 3,480 the right liver living donor and its corresponding recipients are included. And I briefly the review of the background study of our research. And the interior dermatitis center study group the reported the portal vein and hepatic vein variation is the significant risk factor of donor. And in laparoscopic the liver surgery, and the two hepatic artery in the graft was a significant risk factor for the biliary leakage in the right liver, the living donor. And another study in this group was reported the portal vein variation has shown for the short-term the complication-free survival. And this is the living donor data of the Japanese group, and this group reported the strong correlation of portal vein variation and the bile duct variation. Based on this finding, we hypothesize that the portal variations can affect the biliary tract the complication of living donor. And another factor we consider in our risk factor analysis is fatty liver. The fatty liver is not a factor though, but it is a significant indicator for assessing the graft quality. So we consider this factor in our analysis. The Seoul National University group reported the moderate macrostenosis, also the significant risk factor of living donor. And our center reported a portal vein reconstruction technique using the Y-shaped graft of the portal vein of donor for the variation of anastomosis of portal vein. And we also reported the reconstruction the technique for the multi-opening of right inferior hepatic vein. And 3 years ago, our centers reported the outcome of endarterectomy the technique in the case of a middle hepatic vein reconstruction using the aorta. They considered this the surgical procedure in our analysis. And this is the general characteristic of living donor, including graft factor and anatomic characteristics, including the variation. And this is the general recipient characteristic of recipient. In our the complication of the living donor, that we report all types of donor complication. In this data, included crabby and Dindu grade, and the types of complication, its management, and its number. However, we present the recipient the complication into the biliary complication and the vascular complication, because these complication is strongly associated with the graft characteristic of living donor and the surgical procedure, including the reconstruction technique. In the reasonable risk factor analysis for the major the donor complication and biliary donor complication, the various factors, including graft factor, the anatomic characteristic, including variation of operative layer and the fatty liver, are considered. In the recipient complications, weird analysis, the postoperative 90 days of the complication-free survival as represented cumulative event and the graft survival during the follow. In hepatic artery complication, firstly we consider the multiplicity of hepatic artery and the surgical procedure straining an artery ligation or the embolization, which is we have been performed for the improving the hepatic artery flow sometimes. In the portal vein complication, we considered in this analysis the multiplicity of opening And in the case of a variation of a portal vein, the Y-shaped portal vein plastic group and non-Y graft portal vein plastic group was compared. And the portal vein, the stent insertion intraoperatively, and the portal vein thrombectomy group was compared, the non-procedural group. Actually, the middle hepatic vein, the complication was the most common, the vascular complication of the recipient. And we consider in this analysis, and firstly, the graft time in terms of extended right liver and the modified right liver. And the multiplicity of the middle hepatic vein, the opening need to be reconstructive. And in the case of modified right liver graft, we compare the synthetic conduit graft and the non-synthetic conduit graft. And in the case of non-synthetic conduit graft, we compare the iliac vein graft and aorta graft. And in the case of middle hepatic vein, the reconstruction using the aorta, the endarterectomy group and non-endarterectomy group was compared. And for inferior right hepatic vein, the complication, the multiplicity of the opening and the types of the plasty was considered in this analysis. The plasty was the two inferior hepatic vein, the conjoined plasty, and the inferior, the right hepatic vein to the right hepatic vein. And for the biliary complication, the multiplicity of opening was considered. And in the case of a barrel type, the biliary ducts, the ductoplasty for the single the opening group and non-ductoplasty group was compared. And in the double barrel type of biliary duct, the double stent group insertion group and single stent insertion group was compared as well. And for the separated bile duct,
please cases, focus on your study plan, please.
Yes. This is the kind of the univariate survival analysis, and the result of the risk factor analysis for the recipients will present, and the risk of the factor analysis outcome, and specifically the vascular complication in terms of hepatic artery, vein, and portal vein, and the biliary complication in terms of biliary stricture and leakage. And we consider this kind of the covariate. The main purpose of our study is to find the favorable anatomic characteristic of right liver and the optimal surgical procedure and reconstruction technique. So this identified factor will help deciding the optimal surgical planning for the donor and recipients. Thank you very much.